It's my great pleasure today to introduce Dr. Patricia Ramos and Dr. Susan Good. They are the co-founders of the Network of Medical Audiology Professionals. They've been very involved for the last 5 years in the upcoming FCOM meeting, which this year is going to be one of the best ever. So, Dr. Ramos, can you tell us why you're so excited about this year's meeting, please?
Yes, Matt, thank you so much. When you have a vision for a collaborative environment and you start to see it come to fruition, we as Network of Medical Audiology Professionals really are focusing on developing the community of collaboration around providers that are influencing and treating the patient throughout their journey. And I think that's the most exciting thing for me, which I know may not sound like an exciting feature for a lot of others, but to see the medical provider communities coming together for the benefit of the hearing care of our patients is super exciting. And I think this year's lineup is really going to demonstrate that with a lot of our speakers and our exhibitors and sponsors. I just think it's going to be a fantastic meeting.
Yes, I think it's going to be a great one as well. Dr. Good, what's your take on this year's meeting?
This year, it's definitely bigger and a lot more expansive than it ever has been in the past. Last year was our first year where we really kind of took the message and the work that we do for this Florida meeting outside of the boundaries of the state. And we did that from a virtual standpoint, and it really exceeded our expectations by, hundredfold. There was a tremendous amount of interest in the work that we do here, and it means a lot to us because Patty has worked in ENT, for probably more than 35 years. I've always worked in and around ENT myself, and really just being engaged with the medical community in an environment where everyone is sitting in the same room and has the opportunity to participate, not just the attendees, but also our speakers and all of our industry partners, our exhibitors and sponsors also attend the courses and really participate and offer their expertise right alongside the physicians and the physician assistants and the nurse practitioners and the audiology team, and even the business administrative groups and clinical staff. And we're even seeing a tremendous group of students, both audiology, physician assistant, particularly spending a lot of time within the meeting and participating right along all of the providers. So it really has been pretty special these past 2 years. Last year was a surprise. We were glad how far we could take it. And this year, it really is an extraordinary lineup.
Excellent, well done. So can you give us some of the highlights of this year's presentations and some of the outstanding people who are going to be presenting, please?
Sure, I can name a few, and I'll let Patty answer also, because I think that she has worked tirelessly to make sure that the agenda, particularly the medical audiology track, has the depth that it really needs in order to not just have one provider perspective. This year, we're extremely happy to have Frank Lynn kicking off our otology medical audiology track with his keynote. And then following that, we have two tremendous panel discussions and a number of panel discussions within the agenda itself. And in each panel, we have been very particular to make sure that we have not just one provider or one scope of practice perspective in order to give us a very broad and robust feel for what that patient experience really is in the medical environment. When you see a patient as part of any system, whether you're within an ENT practice, whether you are part of a referral system, whether you sit in a hospital system or big medical system, it really is not surprising to any of us who have been patients that you have to really kind of piece your your care together. And the more work that we can do as providers, learning from the same source, participating alongside each other, understanding each other's perspectives, I think helps that patient journey throughout their care with us. And we really have focused on having physicians, physician assistants, nurse practitioners, and audiologists on our panels. And I think the two panels that afternoon are, there's a specialty panel about surgery and rehabilitative care. And there is also a new topic that Patty is really close to, which is the clinical trial work that is being done in ENT and audiology today. So they'll be doing some good, we'll be hearing some good information, fairly well-rounded.
Great, thank you. Dr. Ramos, can you tell us a little bit about the clinical trial portion of the program, and also about how excited you are about the program this year being virtual and in person?
Absolutely. Well, as Susan mentioned, clinical trials is something that we as a practice at ENT and Allergy Associates of Florida have been involved with in the ENT space for a number of years, as well as in the audiology space. And what is happening in medicine today around the hearing care area is multifaceted. You have the clinical trial work that's been being done in the clinical arena on hearing restoration. There's all types of technologies that are out there in the forefront of medicine that are coming to improve the patient experience. So clinical trials, I think, is an area that people may not be that familiar with in that clinical space, but it is such a rewarding area to be in, to be able to help advance medicine. The virtual component, I just can't say enough about. I think Susan mentioned how last year, because of COVID, we pivoted and went totally virtual. We had no on-site meeting, and the attendance just blew through the roof. The comments, I believe, are what really provided me the most satisfaction, is that people really saw value in the way that the presentations were done, where you're in that collaborative multi-provider space. And each provider is speaking to how they work with other providers to advance that patient's care. So, the hearing space is extremely disruptive right now in a good way, meaning that hearing is in the forefront right now between the cognition studies, the clinical trial work, the things that are happening about comorbidities has really just, I believe, has given us the opportunity to elevate the education that's needed across all of us as providers, as we're tying in more of those comorbidities into our patients' care.
Dr. Good, would you give us a little taste of your excitement about the virtual and in-person meeting, please?
Sure. We are excited for both attendee sets. Our in-person attendees will have a few extras on site that really bump up the value of their meeting. For instance, there are two pre-cons. One is sponsored by the American Institute of Balance with Richard Gans that is available from 8 till noon. And our afternoon pre-con, as Patty had mentioned, with the amount of work that clinicians are doing today around cognition and just dementia and a number of associated disorders, Cognivue will be sponsoring that afternoon session. And that will be from, I believe it's from 1 until 5. So those are two special things that you get when you're on site. But from a virtual standpoint, I think the meeting is just as robust. So Cognivue and AIB are both doing extra special things for the virtual audience that they're not doing on site, just to make sure that our attendees get that little extra oomph that they might have missed from one workshop format to the other. Additionally, our format this year, instead of just being a day and a half, is 2.5 days, or I guess 2.5 days of good content Some is delivered premiered, where the speaker is presenting and answering questions. And some of it is even live broadcast as it's happening on site. The virtual attendees will be attending at the same time, which is really exciting for us this year, and be able to interact with the audience that is in Naples and around the world, and let the speaker address both audiences at the same time, which is a true hybrid experience. We also have a couple really special hub experiences that are happening for our virtual group, where EarLens is supporting manufacturing tours and a few sessions from their location in California. So we're really trying to branch out and bring everybody together, at least in the virtual space, and to allow everybody to do that where they're comfortable and where they have the opportunity to throw on their sweatshirt in the morning and not have their camera on, or if they want to do their hair and put on their polo shirts and get after it on video, they still have those opportunities also to interact with each other. I think another thing that Patty might be interested in just mentioning is our extraordinary exhibitor sponsor lineup this year. We have so many different companies that are participating, much more than in the past.
Absolutely. As Susan said, we have this year 54 exhibitors and sponsors that are going to be on site, and those also will be carrying virtual booths as well. And what has been exciting is that we have had to turn people away because of staying within COVID restrictions within the Ritz and making sure that we've got adequate spacing and stuff has limited our exhibitor number for this year. But it's exciting when you see companies get excited about a meeting that you are putting on, because that really speaks to the fact that you're kind of hitting the road in the right place, that where there's a need for good collaboration and great exchange to really make that patient experience. And I think if, as all of us in healthcare, if we always keep ourselves focused on the patient and the end result, we naturally are going to fall into collaborative relationships with medical providers that are interfacing around that patient's care. And I just think it's something that was the goal, as we know, of electronic medical records. And we also know that that's not working very well because of the way that the electronic medical record system is set up. So we really have to be able to reach out, not just electronically, but reaching out into our colleagues that are providing care for our same patient, so that we can ensure that they get the very, very best care and following through the collaborative environment. One example of that would be like the patient with diabetes. Okay, we know that there is a tie. We don't know the extent of the tie at this point. Research is still ongoing, but there is definite impact to the diabetic patient and having accelerated hearing loss. And so being able to get that information out into the primary care areas and those mid-level providers that are really supporting those patients and is extremely important, because hearing, I believe, has really been something that got pulled out of the medical arena in a lot of ways because of the lack of research and just the research that needed to be done within the area of hearing, which is super hard to do. Super hard to do scientific studies on a system that if you open the inner ear system, now you have just killed it. So it's hard to do a lot of comparative research in this area. So I think the science is finally starting to catch up with us. And so that's super exciting. Another very exciting thing about a hybrid meeting or a virtual meeting is, like we saw last year, we were able to attract over about 200 international attendees, both on the ENT side and the audiology side. And our goal this year is to stretch even further, to get the community as a global community, communicating and sharing and collaborating so that we can accelerate the information that we have in these areas.
I think one of the things that we've done a pretty good job at this year is really expanding the amount of access information available about the meeting. Last year, we had kind of a quick sprint to virtual. This year, we've had a little bit more time to do some planning. So the website, FCOM now, FCOMNOW.com, is up and really has laid out all of our exhibitors and sponsors, all of the agenda with all 5 of the tracks. There's a business of medicine track for our administrators and the clinical support teams, those operational teams. There's a virtual meeting. We all, of course, have the medical audiology track that Patty and I continue to support. And then there is the general ENT track that covers all of the specialties underneath. Facial plastics track also underneath that. They've done a nice job with lifting up not only the technology workshop as they have in the past, but are really growing the allergy workshop and the med spa workshop this year quite considerably. They'll be available both in person, and a number of those sessions will also be available online for physicians and other specialists within ENT and beyond that are interested in those topics. And I think one of the things that kind of surprised Patty and I last year, and we, in a way we were like, of course, this is a really popular topic, as we put together quite a broad overview of audiology sessions for the physician assistants, nurse practitioners. Tremendous interest from those mid-level providers. However, also just a tremendous interest from audiology in general. And we really have focused on expanding that that workshop for all of those mid-level providers even more this year, to make it available online, where you have the otologist talking about the basics of cholesteatoma. You have physicians talking about reading radiology, that has to do with the ear, and just things that audiology might be just right outside of our scope, but things that still touch us every day in clinic that we see come across. And it's nice to have a broader and more, a deeper understanding of those aspects of diagnosis and kind of that treatment or surgical differential diagnosis, the way they work through things and determine how, what they're going to do when they're in surgery, or what they're going to do post-op, and, when rehabilitation might be considered, or when we want to consider something that might be a surgical solution for the middle ear, for the conductive hearing loss, versus moving right into something that is a more traditional technology. So really, those types of sessions have been, we really took the feedback from last year and not only created the fundamental sessions that we think people that are just learning about the specialties, or that want a quick refresher on the fundamentals, but also taking those and creating more advanced and sessions that have more depth to them for the more experienced or advanced clinician.
I think another very unique thing about this meeting as well is that on the close of the meeting, we have a roundtable that we're going to be doing about the future of audiology, the future of medicine, where we see things going. Of course, there's a lot going on right now within the legislative arms around or impacting hearing care. So we're going to have, I'm certain, a very robust and fun time, because Dave Fabry is going to be the one that's moderating. So anytime Dave is involved in a talk, we always have a lot of fun, but we also really touch on pertinent issues. So it's very excited about that as well. Another great component about this meeting is that we really are reaching into the university environments and working within providing this information to students that are in specialties, whether they be medical students, PAs, nurse practitioners, audiologists, audiology assistants, again, anyone, hearing care professionals. You don't have to be in the same house with an ENT practice to be in an area of collaborative care for your patient. We all know that. And so this is really something that we just want to encourage from the beginning of the education experience for students, that we all learn from each other. We are all better when we do that. And I think that bringing that excitement of students and their drive for information and understanding. It helps to keep the excitement around what the work we're doing.
So because we're so obviously passionate about starting education as early as we can, for all of the virtual student attendees, there is it's a complimentary pass to all of the courses. They have access to all of the tracks: ENT, audiology, PA, otology, and so we're really and the business tracks. And so really, it is a nice way for them to get in and kind of settle down next to all of the practicing providers that are in the room and the industry professionals, and really hear their perspective and participate in the Q&As, and really kind of just take it all in and really get a more multi-specialty perspective around what they may be studying in school.
So you've heard a little bit about the meeting. We've talked about all the different opportunities educationally within the different tracks that we have going. And now all we're missing is you. So we want you to please engage with us. Check out the agenda at FCOM now.com. We have, as Susan said, an incredible meeting planned with a lot of fun and a lot of exciting speakers. So we just look forward to you being with us. So come on and join us virtually. We expect to have an incredible meeting. So we'll see you there.